Imagine waking up one day and realizing that the world doesn't line up the way it should. One eye sees straight ahead while the other drifts off target, creating a double image, a blurred moment, or a sense that something is just not right. For many children and adults, this isn't a dramatic movie scene. It's their everyday reality. And the condition behind it is called strabismus, more commonly known as crossed eyes. It's far more common than people realize, yet deeply misunderstood. Strabismus happens when the eyes stop working together as a team. Normally they move in perfect synchrony, locking onto the same object and sending a single clear picture to the brain. But when one eye turns inward, outward, upward, or downward, the brain receives two different images. In children, the brain often chooses the stronger image and blocks the weaker one, which over time causes the turned eye to lose clarity. That's how a lazy eye or amblyopia forms, and this is exactly why early detection is absolutely critical. The causes behind strabismus can be as simple as a muscle imbalance, or as complex as nerve problems or developmental issues. In children, it often appears without warning due to differences in muscle strength or the signals controlling eye movement. Sometimes it runs in families, sometimes it's linked to uncorrected farsightedness, where the constant effort to focus pulls one eye inward. In adults, strabismus can develop after trauma, nerve damage, thyroid disorders, diabetes, or sudden changes in the muscles around the eye. And once the eyes lose alignment, the brain struggles to merge the two images, leading to double vision, headaches, difficulty focusing, or a feeling that the world is tilted. What makes strabismus especially tricky is that it's not always obvious. Some people only show a misalignment when they're tired, stressed, or concentrating. A child may tilt their head, squint one eye, or avoid looking directly at faces. In photographs, one eye may drift slightly, just enough for a parent to wonder if something is off. These small signs are easy to dismiss, but they should never be ignored. The important thing to know is this: strabismus is treatable, and the earlier it's addressed, the better the results. In children, glasses can sometimes correct the problem by reducing the strain that causes the eye to turn. Vision therapy, specialized exercises, and patching the stronger eye can help rebuild the connection between the eye and the brain. In cases where the muscle imbalance is stronger, surgery can gently realign the eyes, allowing them to point in the same direction again. For adults, treatment depends on the cause. Some cases can be managed with exercises or prism corrections, while others benefit from surgical alignment, not for cosmetic reasons, but to restore comfortable single vision. If strabismus is left untreated, the consequences can be long-lasting. The brain may permanently suppress the weaker eye, leading to loss of depth perception and reduced visual function. In adults, untreated strabismus often results in persistent double vision, eye strain, and difficulty with everyday tasks that require precise binocular vision. That's why regular eye exams, especially for young children, are essential. Supporting healthy eye coordination doesn't require anything extreme. Simple habits make a big difference. Giving children time outdoors, reducing long hours of near work, balancing screen time with distance focusing, and maintaining good posture and lighting while reading or studying. These everyday choices help the eyes relax and work together more naturally. Strabismus is not something to hide, ignore, or be ashamed of. It's a medical condition, and one with real solutions. With proper evaluation and timely care, most children and many adults can achieve dramatic improvements in alignment, clarity, and confidence. So if you've noticed wandering eyes, subtle drifting, or unusual head positions in yourself or your child, don't wait. Early action can change the future of vision. Ko'z Nuri Eye Clinic, protecting the vision of tomorrow.